Hello and welcome. Today, we're diving into a condition that affects the clarity of your vision, corneal neovascularization. We'll explore what it is, why it happens, and what can be done about it. Prepare to learn about the intricate workings of your cornea and the challenges it faces when new blood vessels invade its normally transparent space. So, what causes this unwelcome intrusion of blood vessels? Corneal neovascularization, or CNV, is rarely a primary disease. It's typically a response to underlying issues. Common culprits include chronic inflammation, such as from dry eye disease or allergic eye conditions. Infections like herpes simplex keratitis or bacterial ulcers can also trigger CNV. Trauma to the eye, including corneal abrasions or chemical burns, can initiate the process. Even wearing contact lenses, especially if they're ill-fitting or worn for extended periods, increases the risk. In some rarer instances, systemic diseases, such as rheumatoid arthritis or Sjogren's syndrome, can indirectly contribute to CNV development. Now, let's understand the how. The cornea, normally avascular, meaning it lacks blood vessels, relies on diffusion of oxygen and nutrients from the surrounding air and tears. When the cornea is injured or inflamed, it releases signaling molecules called angiogenic factors, the most well-known being VEGF, or vascular endothelial growth factor. VEGF acts like a build signal, stimulating the growth of new blood vessels from the limbus, the border between the cornea and the sclera, towards the site of injury or inflammation. These new vessels, while intended to aid in healing, disrupt the cornea's transparency. They leak fluid and lipids, leading to scarring and ultimately vision impairment. While precise numbers are elusive, corneal neovascularization is a fairly common complication associated with many ocular conditions. Its prevalence depends heavily on the underlying causes in a specific population. For instance, in regions with high rates of trachoma, an infectious eye disease, CNV is more prevalent. Similarly, in areas where contact lens wear is widespread, CNV associated with contact lens overuse is more frequently observed. It's important to note that individuals with a history of corneal ulcers, trauma, or chronic inflammatory eye disease are at a higher risk of developing CNV. The signs and symptoms of corneal neovascularization can vary depending on the severity and location of the vessels. Early stages might be subtle, with only mild discomfort or blurry vision. As the condition progresses, you might experience increased sensitivity to light, known as photophobia. Redness and irritation are common. The presence of visible blood vessels on the clear cornea is, of course, a key indicator. Most significantly, the advancing blood vessels will impede the passage of light, which result in decreased visual acuity and progressive visual distortion. Diagnosing corneal neovascularization typically involves a comprehensive eye exam. Your ophthalmologist will use a slit lamp microscope, a specialized instrument that allows a detailed examination of the cornea. This allows the doctor to identify the presence, location, and extent of the blood vessels. Corneal topography, a mapping of the corneal surface, can reveal irregularities caused by the neovascularization. In some cases, corneal angiography, a technique that uses dye to visualize blood vessels, may be performed to assess the extent of the new vessel growth and leakage. While there aren't strict types of corneal neovascularization in the traditional sense, it's often classified based on its depth within the cornea's superficial, stromal, or deep. Superficial neovascularization involves vessels on the surface of the cornea. Stromal neovascularization affects the middle layer, while deep neovascularization extends towards the innermost layer near Descemet's membrane. Also, CNV can be described as focal when it is in one small area or diffuse when it is spread on the entire corneal. Treatment for corneal neovascularization aims to reduce inflammation, suppress new vessel growth, and improve vision. The approach varies based on the underlying cause and severity. Topical corticosteroids, in the form of eye drops, are often used to reduce inflammation. Anti-VEGF medications, either as eye drops or injections, are the cornerstone of treatment for many cases. These drugs directly target and inhibit VEGF, preventing further blood vessel growth. In some cases, surgical options like corneal transplantation or phototherapeutic keratectomy, PTK, may be considered to remove scarred tissue and improve corneal clarity. Another less common option is argon laser photocoagulation to occlude and cause regression of the vessels. Contact lenses, specially made for corneal neovascularization, can improve vision and protect the cornea. Preventing corneal neovascularization hinges on managing the underlying risk factors. Practicing good contact lens hygiene, including proper cleaning and avoiding overnight wear, is crucial for contact lens wearers. Prompt treatment of corneal infections and injuries is essential. Individuals with dry eye disease or allergic eye conditions should adhere to their prescribed treatment plans. Regular eye exams are also important, particularly for those with a history of corneal problems, to detect early signs of CNV and initiate timely intervention. The prognosis for corneal neovascularization depends on the underlying cause, the extent of the neovascularization, and the response to treatment. With prompt and appropriate management, many cases can be stabilized, and vision can be preserved or even improved. However, untreated or severe cases can lead to significant vision loss and even corneal blindness. Recent research is focused on developing more effective anti-VEGF therapies, including gene therapy approaches, and exploring novel anti-angiogenic agents. Furthermore, research into the role of specific inflammatory mediators in CNV is paving the way for more targeted therapies. The future holds promise for better treatment and prevention of this vision-threatening condition. Thank you for joining us on this informative journey into the world of corneal neovascularization. We hope you found this beneficial.